Good evening and welcome to Tabernacle Church Live Life Class on Tuesday, 7 o'clock, 7:30. Excuse me. We go live every Tuesday, bringing you content that is relevant to helping you live your life and navigate through this time and this unprecedented crisis. I'd like to welcome my partner and better part than me. Couldn't do this without her. She's so talented. Myra Herring.
Thank you, Taylor. It gets better like every week. He adds things, and I'm just like, oh my gosh, I have to live up to this.
Yes, yes, and you always do. So if it's not broken, we're not going to change it.
All right.
In
Well,
any event, thank you for being here. I want to shout some of you out that are online. We're going to do that here in a second. I also want to let everyone know we have a very special guest with us today. Dr. Wilson is with us today. As I mentioned on Sunday, states are reopening, and we need to hear from a medical professional about how to navigate through states reopening, what is good, what is not good, and answers any questions that you may have regarding this. It's really important to us that we bring all our congregation, our family, and extended church family relevant information that you can trust from directly from the horse's mouth, so you can hear it and trust it firsthand. I know many of you miss coming to church, many of you miss being at church, but today we're going to understand a little bit more about those risks and whether or not it's even worth us doing it. So thank you for joining us. I
yes.
am trying to see if people are on. Myra, why don't you?
Yeah. So I'm very excited to be here to be a part of this conversation. It is critical. We are going to have an amazing guest join us. It's actually a part two, if you will, because it is a continuation of a conversation we started some weeks back,
Yes,
actually. And
actually.
so we have our guest returning because it is oh so relevant, so important right now. And she just has, great information to share. She's on the front line. So
Yes,
we're going
yes.
to be talking with Dr. Melanie Wilson. We'll tell you more about that in a little bit. I think we've got some people joining
Mhm.
online.
Uh, Marsha Dobbs want to thank you for joining us. Robert Manley, good faithful. Thank you, Robert. Love you very much. Crystal Turner, Stacy Robbins, Sean Jackson, also an essential worker.
Welcome.
Welcome, Sean. Devonna Martin, thank you for joining on YouTube.
Great.
Nita McCarley, gonna shout out a few more folks, and then we're going to bring on our guest and get this thing rolling. Michael, thank you for joining us.
Welcome, everyone. You're in for a treat. Dean Nails, thank you for joining.
All right. Well, we thank all of you for joining. We're not going to belabor the moment any longer. Myra, why don't you go ahead and bring our special guest in?
So I think, our guest needs no introduction. I guess it's, new for some, a reintroduction for others that joined when we had this session some weeks back. We will have our Dr. Melanie Wilson rejoining us all the way from New Orleans, I believe.
Yes.
And I will let Dr. Melanie introduce herself. Can you tell us a little bit about your role and what you're doing in New Orleans? Good.
As some of you remember from the last time we spoke, I'm an anesthesiologist here who's also boarded in critical care medicine. So when the pandemic started, I switched out of the operating rooms over to the ICU because we were overwhelmed, resources were low, and the patient census was high. Since we started to see that flattening of the curve that we talked about that we were trying to get to, I've now switched back into the ICUs at this point in time.
Perfect. Well, first of all, thank you for your service because I know every day being on the front line is not an easy task. And, I can't imagine all of the things that you're dealing with. So thank you for your service. Thank you for, showing up every day. We need you. The people need you. I know it's important work that you're doing. So let's just jump in. And can you kind of just level and tell us the landscape, like what you're seeing now? We had this conversation weeks ago. What has changed? you talked about leveling out the curve. Are you seeing that? Are you seeing things different than what we saw or what we talked about some weeks back?
I am. So again, when this all started about 7 weeks ago, we were seeing a stress on the healthcare system, an overwhelming amount of patients who were coming in who were very, very sick. We were low on personnel. We were low on ventilators. We were low on personal protective equipment. The ICU at that time was overrun. We even had the ICU satellite locations in 2 different locations in our hospital.
Wow.
Since the stay-at-home order was put in place, we have seen again a flattening of the curve. We have since then closed those 2 satellite ICUs, and now we actually even have open beds in our ICU, and the ICU is not overrun with COVID patients. So probably our ICU beds, we have 32 beds in our ICU. Maybe about less than half of them now are COVID positive patients, and the rest of them are routine ICU patients that we would see on a normal basis.
So would you say that that is a good thing now, that there are more beds, or how would you quantify what you just told us? How's that relevant to our audience?
So the interpretation is interesting, right? So again, the whole goal was not that we were going to be able to eradicate this disease. That was not what we were going to what was going to happen. Our goal was to free up our healthcare system so that we were able to take care of the patients that got sick, so that everybody didn't get sick at the same time and we overrun the system. So now we've seen that with the stay-at-home in place orders and the measures that the government has rolled out. We have seen that situation where now, there's less tax on the healthcare system, and we are now better able to take care of patients that will come in.
Okay.
So we do realize staying at home is not going to be, a long-term solution forever.
Yeah. So with that information, if the long-term goal was not to eradicate the disease, and we're seeing that beds are opening up, and we wanted to make sure that the healthcare system had the adequate amount of beds and workers to actually deal with patients, would you say that maybe it's a safe time? And I know you're practicing a medical practitioner, and you're not in politics, but would you say it's a good time to open up states? Like, is that maybe a good indication that because we've got some beds available, that it is safe to do that?
That's a good question.
So again, we're dealing with right now competing interests, okay? So there's the interest of the economy and people who need to make a living, okay? And there is the interest of your personal health. And at this point in time, these things are not necessarily aligned, okay? So that is the issue that we're dealing with.
Yeah.
Now, everybody has to deal with this on a state by state basis because there are criteria that need to be met in order to say, is it safe for us to kind of start to roll out or phase in reopening? And part of that is that we wanted to see a 2-week decline in cases in said state before that happens.
Right.
In terms of safety to reopen, it does need to be a measured approach because we do not want to get into a situation that we saw back in March. And that could very well happen if this is not done correctly and appropriately.
Yeah.
So it's there are two non-mutually exclusive elements happening: personal health and economic stimulation, if you would. And
Correct.
where do you stand as a medical profession with what you're seeing in DC, Washington DC, where the head of our government is, and you actually in the medical field? Where are you standing in the middle of all of this?
So obviously, I err on the side of healthcare. I do understand and greatly appreciate everyone's concern and willingness to want to protect their families financially. I get that that is a very real concern. But also what is a real concern is that this has not gone away. And I just don't want everyone to be lulled into a sense of safety. Because we've stayed at home, we have seen a flattening of the curve. We haven't seen, the cases rise as dramatically as they were. We're not hearing those stories that we were at the beginning. But that does not mean that this disease is eradicated. It's still there. It's still as deadly as it was when we saw it 7 weeks ago. It's not gone.
So question for you. Being that the disease is still there, there's a lot of research about the disease, right?
Mhm.
I listened to NPR, right? Um, on the radio station the other day, they were saying how they were doing clinical trials trying to understand the disease, and they just put the disease, had COVID patients in rooms or whatnot. Then they went in the rooms with protective gear, and they used, they were, testing the room to see
Mhm.
if the COVID was still in the air, if it got on the walls. And while there may not have been any COVID, like actual disease that somebody can get, there was traces of it. So they're still learning about the disease. With them still learning about the disease, has it mutated? Is there a different strand? I mean, where are we in the learning process about
Mhm.
what this disease is? Do we know any more than what we had 7 weeks ago?
I think we know more than we knew 7 weeks ago in terms of what it does to the body. So we do know more than we knew 7 weeks ago, but there's still so much that we don't know.
Wow.
Is it mutating? Possibly. We don't know. Uh, can you get it again? Possibly. We don't know.
Oh my God.
And so I know it's a frustrating thing to say that we don't know, but this has only been on our radar, even worldwide, since December. And so for
Yeah.
us to have learned as much as we've learned in 6 months, I think is very, very rapid, and that's amazing. Because it's hard to study these things. So the long or the short answer, I guess, if you will, is we do know more than we knew 7 weeks ago, but we're going to know a lot more in the fall.
Yeah.
Right. So basically, this is how science works,
Yeah.
right?
It takes time.
It takes time. It's a process,
Yeah.
right?
And we benefit when we let the process work because, there's fears of people taking vaccinations too early and it not being tested well enough and things like that.
Well, since you said vaccinations, why don't we kind of talk about that? Because I don't get flu vaccines.
Yeah.
I'm a little afraid of that.
Yep.
I've
Same
never
here,
gotten a flu vaccine, but I've never gotten the flu during flu season. So why don't you shed some light on that? I mean, I am an African American male.
Yep.
Typical. I don't like to go to the doctor kind of thing, and I'm scared of vaccines kind of thing. So
Mhm.
enlighten, your brother, Melanie. Sorry.
You know what? And we'll touch on that. And that's going to segue into, something that we'll talk about later in this program about disparities in healthcare in the African American community. The fact that you don't want to get vaccines.
Yeah.
Vaccines have been shown to, really eradicate diseases or phase them out that used to be deadly. We don't see polio anymore,
Yeah.
Wow.
the vaccine,
Yeah.
but it was very deadly 50 years ago.
Wow.
Yeah.
Tetanus, we don't see that. That's deadly. We
Yeah.
have a vaccine for
Wow.
it. And even things that we saw. I don't know if you had chicken pox as a child.
I did.
I
Yeah.
did. There's now a
I did.
vaccine. Our kids will not get that.
Wow.
And the fact that we got it as children, it wasn't deadly, but it might be, worth noting that can be a lethal virus in a older person. Same with measles, mumps, and rubella.
Absolutely.
Those we don't see those anymore, and those are deadly viruses
Mhm.
because we have vaccines.
And I'm sure it
Point
took
taken.
years
Thank you.
for those vaccines to be developed and tested and people to feel comfortable taking them. So I want to take a step back because I actually learned that you tested positive for COVID-19.
I did want to say that too.
And
We're here.
yeah, and you recovered. And everyone may have not been a part of the original broadcast where you were a part of that. Can you share a little bit about that story and then tell us about, post COVID, like your life post COVID, how you recovered and what you noticed during that process?
Right. Sure. So I again, 80% of the people that will get the virus had a relatively mild disease.
Okay.
I remember the first day that I had symptoms, I was out taking a walk with my son. I came inside and I was sweating. I took my temperature. It was 102.6. I thought maybe, I had just overheated in the sun, and it was allergy season as well, which can be complicated. I know Georgia has a very intense allergy
Heavy
season.
pollen.
Heavy, heavy, heavy.
So I was, I attributed my symptoms to allergies. The next day I didn't feel so well. And thankfully, through my job, since we come in contact with a lot of patients, if you're not feeling well or you have any symptoms, this was early on when testing wasn't widely available, they would set you up with a test. And I got the test and I was positive.
Wow.
Throughout that process, I did get, I was I remember being just very fatigued. I was
Mm.
exhausted. Um, I had fevers, I had chills, I couldn't smell or taste my food, but
Mm.
generally, I just really did not have the energy to do things.
Mm.
About day 5 or 6, I started to develop a little bit of a cough, and then I realized that I was short of breath, just kind of doing everyday activities, coming to make breakfast for my son or waking him up in the morning. I just felt white.
Yeah.
It took me about 12 to 14 days to kind of feel back to normal enough that I was able to return to work. But since then, I don't know, if you know that viral illnesses can linger. So there was a
Mhm.
cough that lingered for a couple of weeks. There was shortness of breath that lingered for a couple of weeks. And on the other side of it, this is now about 5 weeks out. I still feel a little deconditioned, but for the most part, I would say that I'm probably about 95% back to normal.
What?
Wow. That's a
That was
journey.
definitely more detailed than the first time.
Mhm.
Quite a journey. So, are you able to exercise without getting fatigued or
I do. I exercise every day, but but again, like most people in COVID, I don't know if it's just because I'm out of shape because you know, gyms and things aren't open, or because of the COVID. I know that what we are doing is treating these people like they have reactive airway disease afterwards. We do know that there is some lung injury that remains after they heal from the virus.
so,
Yeah.
that lung injury because that's one of the things my dad always talks about and is seriously afraid of.
Mhm.
You get your lungs get scarred and it
Yeah,
could
your whole respiratory system.
right. So when your lungs get scarred, does that take years off your life potentially, or is that a misnomer?
Not necessarily. Not necessarily. If you know how to manage it. I mean, these it's not severe enough that you're going to have to be on lifetime medication or that you can't do normal things, but it is something that is noticeable.
Mhm.
That maybe you're winded a little bit more quickly, or maybe the cold air might hit your bronchus. Reactive airway means that your airways. So the trachea and the bronchi are naturally very reactive to stimulus. When they have injury and insult and they're trying to heal, then they're more reactive. So maybe you're more reactive to the cold. Maybe you're more reactive to toxins and you cough a little bit more. It doesn't mean that it takes years off your life, but it might be things that you might see. Your exercise tolerance might not be what it once was. It can get there again. But it does take time, and viruses are indolent and they last a really long time.
Wow.
Yeah. So
So
we talked a little bit about the vaccines, and Taylor shared some information just about his hesitation, and I think it is something that's probably prevalent in the African American community. It could be distrust issues, with the healthcare system, or if we go back to history of us being tested for things, and just having a lack of trust in the healthcare and having to rebuild that. What thoughts or maybe even advice would you offer, or even your perspective on getting vaccines? Some people get vaccines and still get sick. What are maybe some thoughts that you can offer to those that don't have trust and fully understand how this vaccine works?
So again, there's no perfect medication, there's no perfect treatment, and there's no perfect prevention. So
mm,
just to understand that
Yeah.
the goal in vaccines is to reduce the chance that you will get whatever set disease. So the way that a vaccine works is that there are live vaccines and there are dead end vaccines. There's
Mm.
two types. Um, and so basically, what they do will introduce a small inoculum of the antigen into your body, and the goal is to not to produce an immune response, so
Mhm.
much so that your body has the memory and forms that immunity, but not so much that it can make you sick. And so that's where it gets into why vaccinations take so long
Yeah.
to come out. And I know that that's a question, why can't you just make it? Because we are introducing a disease into your body
Mm.
so that your immune system will react to it and form memory, so that
mm,
it does come in contact with that same antigen again in the environment, your body remembers it and has the antibodies towards it and fights it off before you even knew it was there.
Mm.
Now, the question to touch on is, oh, well, hey, I get the flu vaccine every year and I still got sick.
Yep.
Well, there's different strains of flu. And they change every year in terms of which flu virus is, which strain is actually prevalent that year. So
Mm.
basically, they come up with this virus. It's a different vaccination every year. And basically, what they're doing is looking at the science of which flu strains are most prevalent that year and
Wow.
Ah,
help you against those. It doesn't mean that you're protected against the other strains.
Wow.
did not know that.
Did not know that.
So that's why people say, oh, I got the flu virus and I still got sick. Well, you probably got a different strain. We're protecting against the most prevalent and the most deadly strains that year. But then there are some viruses that you probably won't get. The measles, mumps, rubella that I spoke about before, we're not seeing that virus mutate at this point because it's not, in the environment any longer. So
Ah,
you get that virus, you're probably not going to get that disease.
So that was good
yeah.
because you there was two things that were good about that. One, you answered the bishop's question. He said he got the flu shot and got the flu, and he never got the flu shot again. But now we understand he probably got a different strand of the flu after getting the flu shot, which is totally plausible. And I think that is interesting because one thing you said about how we don't see polio and all of these other diseases anymore, right? So I guess what you're saying is over time with vaccinations, diseases fade away.
Correct. And it's like what I talked about,
Mm.
a few weeks ago when I said herd immunity. Herd immunity protects us all,
Wow.
Yeah.
meaning 80% of the people have antibodies to this. So then I can't spread it. If you're not vaccinated, but I get the disease. I'm not, my immune system is going to attack the disease. I'm not infectious. I can't pass it to you. It
Yeah.
doesn't mean that everybody should not get the vaccination. That's not what I'm saying. But that's the concept of herd immunity, which is
Nice.
what we're trying to create in COVID-19 right now.
So another
Yeah.
question that came in, Melanie, and I'm going to try my best to read this. I think I still have 20/20 vision. What what is going on with the coronavirus affecting children?
That is a very new situation. The short answer is I don't really know.
Okay.
Before we thought that they didn't get it, and what's going on sounds like it is a sequelae or after effect of the initial disease that was asymptomatic in kids
Yeah.
that we're seeing after the fact an overreaction of the immune system. This is very, very new. We haven't seen this. This is not in the literature, so I can't really comment on what's going on because we just don't know.
Mm.
Yeah. And I've heard a lot of that is new information. Like they're seeing cases now and different symptoms, and so that's very interesting. And I guess again, we just have to give it time.
We do have to give it time, and
Yeah.
and I understand it's very, very scary. I, as a mother, am also very concerned and scared about this.
Yeah. Absolutely.
So in that same vein about giving the coronavirus COVID-19 time, getting back to something that's really personal to me, states reopening, underlying health issues for the
Yeah.
African American community. Why don't you just take a little time and talk about that? I mean, because I know that I am fine with science. For me, the language of God is not the Bible, it is science. It's how we understand God's earth. It's how we understand our bodies that
Hmm.
are just miracles in and of themselves. We
Yep.
don't control our heartbeats. We don't control our blood flow, but yet, we are these living being creatures. So
Yeah.
science is that language that helps us understand the miracles that we are, right?
Hmm.
So, having said all of that, the states are opening back up. African
Hmm.
Americans have all of these underlying health issues.
And yeah, and can I even
Sure.
add my own personal opinion and observation? I found it odd that a lot of data started coming out around how African Americans were being impacted at a higher proportion. Um, and then I felt like, and it might have just been a coincidence in the timing, I felt then that states reopening was a soon conversation right after that. And we were learning that African Americans we're about 30% of the cases or something like that, and we're what, like maybe 13% of the population. So
That's crazy.
it is a high number. I mean, it's disproportionate. So I personally felt that it was, something that I needed to make sure I was taking a higher precaution, not going out, not getting sloppy with, how we wash our hands
Hmm.
and wearing um, masks and things like that. I don't know if, in my personal opinion, it's time to really start reopening the state, but I understand there is some balance. So I'm just curious as to maybe your thoughts and, kind of piggyback
Right.
on Taylor's question of, is it too soon?
To open
Are
up.
we too much at risk? Like, should we as African Americans be, a little bit more cautious?
That's a great question.
Yeah.
So this is twofold, okay? So I'm going to answer this in parts.
Okay.
Yes, the states are reopening, and we knew that they were going to, and they had to. So let's start here. Just because they're open doesn't mean you have to go out.
Yes.
That's number one.
That's a word that'll preach.
So we knew they were going to reopen, and there were certain criteria that was necessary to be met, allegedly, for the states to reopen. And some of the states have met that criteria, and some of the states have not met that criteria. But really, what I want to drive home is that the onus is on each individual to protect themselves.
Right.
How do I feel about the states reopening? Is it too soon? That's a state by state, case by case question. It depends on, are you seeing, the cases in your state decline? Do you have the appropriate resources in place to respond and react to a resurgence of this virus when and if it does come? So that's how I feel about that. In terms of how the disproportionate amount of cases in the African American community, I mean, that is something important that we all need to be aware of. But honestly, Myra and Taylor, this just brings to light the disparity in healthcare that has existed in the African American community for years. We are more likely to die from cardiovascular disease, more likely to die from cancer, more likely to die from hypertension, diabetes, kidney disease, everything. The only reason that we are seeing this is because COVID-19 now has a national stage, and we are seeing ongoing epidemiologic data that shows who are the people that are dying, who are the people that are getting sick, and it's us. This is no different. This is no different than any other disease that we've had. There's always been disparities for African Americans in healthcare.
It is so true.
So go ahead. I'm sorry.
So with that being said, one of the issues is, yes, access to healthcare, education. So that's why we're here today, right? Yes. Protect yourself. So now, with that being said, in terms of COVID, and this, you need to protect yourself. Just because the bowling alley is open, does that mean that you need to go bowling? Do you need to go?
Do people still bowl? Why are we doing this? Like,
I mean, Melanie, that is great. I mean, we've been doing church in the sanctuary, right? To supposedly ease the pain of not being able to come to church. We were going live. First time we went live, Bishop was in his living room. Then the next time we went live, and he said that was too hard. I never want to do that again. So then I started doing the live in my living room, which you saw, behind the scenes, all of that. And then that was a whole lot. So now we're going live in the church. Every week we have been going live in the church. Somebody has shown up to the church and has come inside the sanctuary. And it's because, you have that itch to come to this place on Sunday morning because, that's what you are used to doing. But if you shouldn't go bowling, you shouldn't come to church, right?
I think, okay, again, right? Like there is necessity and there is non-necessity, and I think as we move forward and things are open, those are going to have to be personal and individual choices, right? Like if I stay home all week and don't go anywhere, and I want to go to church where there's 10 members, is that safe? Yes, but you can't predict the actions of other people. So at this point, you do have to protect yourself. If you're in a high risk group, now if I'm 19 and I have no comorbidities and I go out, Am I going to be as high risk as somebody with other comorbidities? No, you're not. You're
Yeah.
not going to be.
Hmm.
But it's really about being smart and deliberate with the choices that you're making as we start to roll out and have things become open.
Yeah.
And if you are going to go out, then you do need to take the necessary precautions to protect yourself and protect others.
Yeah.
So
Wearing a mask, washing your hands,
Hmm.
as a
Yeah.
as a,
keeping distancing.
as a medical professional, right? I like how you're walking this line. Okay. Yes, it is up to the individual.
Hmm.
Yes, you should pay attention if you're an older person and have underlying health issues. I'm going to get a little bit more pointed. Okay. Um, as a medical professional, is it worth it, you know, to put yourself at risk to come to church? Or can you just watch church on your TV and not put at yourself or somebody else at risk by coming out? I mean, that was the whole thing with the shelter in place. And let's just be honest, there's no vaccine and the disease isn't going anywhere anytime soon.
I will say this. If it were my parents and they called me and said, I want to go to church on Sunday, I would tell them, you're not going to church on Sunday.
Hmm. Yeah.
That's what I would tell my parents.
Yeah. You are in, Dr. Wilson, in New Orleans.
Right.
And you know that there's a culture in New Orleans of, celebration. You all have some of the best parties, just
In the
partying in the
world.
street, just an amazing culture there.
Right.
Um, do you think that people will then need to start to adapt their culture and what they're used to, even with your state reopening soon? I think you said it's going to be eventual and it'll be
Right.
progressive. Yeah. So do you anticipate it being something like a culture shift? Like people will have to start changing their mindset about, what it means to interact with other people, what it means to be social. Like, do you see
Mhm.
that being a shift in mindset?
I do. I mean, I think we're seeing a new normal.
Yeah.
When we reopened here, our phase one is that everything will be open at 25% occupancy.
Okay.
That means a lot in terms of things. I went to Trader Joe's. I don't know if any of you guys have been recently, but I waited outside for 30 minutes just to get in the store.
Wow.
This is what we're going to see because you can't have that many people congregating in one area.
Wow.
You
Okay.
go you might have to wait for a long time just to get into a restaurant that maybe you could just walk into earlier. This is the shift. This is the new normal that we're seeing now until we have a vaccine or a definitive treatment or both.
Yeah.
We just aren't going to have the same kind of luxuries that we had before, and we need to be prepared for that. I know a lot of times Americans, myself included, we have a very short memory span. Something happens and it's bad and we're on it at the beginning and then we
So
get tired
true.
of it.
That's
It's
true.
inconvenient.
Yeah.
I don't want to
That's
put
true.
on this mask because I can't breathe and it makes marks on my face,
Yes.
or I don't feel like waiting outside in line for the restaurant. What's the big deal?
Mm,
But you have to remember, just because we're seeing a decline in the amount of cases, that's because everyone was at home.
That's right.
absolutely.
Now, when people start going out again, we are going to see those cases rise again.
Yeah. Yeah. And that's something we have to be mindful of. And I know you said you're a mother. Schools are trying to figure out, how they're going to send their students back. Will teachers be able to go back? Like, will the environment change? As a mother, do you feel comfortable sending your child back to school? And if you do, what are some of the things you may expect? Do you expect that teachers and students will have to get tested before they go back? Like, what are, as a mother, some of the things that maybe you'd like to see before you'd feel comfortable sending your son to school?
Um, to be honest, I that's a good question. What I would want to see, the way things are now, would I feel comfortable sending my son to school? No, I would not.
Mm,
I personally would want to see a vaccination. To be honest with you,
mhm.
now that might not be very realistic. Smaller class sizes, able to distance themselves, but that's very difficult in our school system to have you know 20 to 30 students in the class. They can't be 6 feet apart.
Yeah.
Um, so at this point in time, the way things are now, no, I do not feel comfortable sending my son back into the classroom.
Mm,
Mm.
that's powerful.
So Dr. Fauci was supposed to, and I know you like Dr. Fauci.
I
Uh,
love Dr.
Dr.
I do too.
Fauci was supposed to say some things regarding states in the U.S. reopening safely. I don't know if that aired already or if you had a chance to pay attention to any of that. But with having said what you said about the schools, knowing that you would keep your parents home from church, um, what is the line? What is the line to walk here? I just still feel a little ambivalent.
Mhm.
Because people, we're in a rock and a hard place. We can't afford mass pandemonium,
Yeah.
right? Like a
Correct.
food shortage or money shortage where people can't get food because then everything goes to right.
Mhm.
So we're trying to walk this medium. We softly reopen so people can work a little bit, make a little money, get their food and stuff like that, and things happen. Um, I just feel like it's rushed. I just really feel like we're rushing this, and more scientists and more health professionals are like, be cautious. You're not doing this right. We're doing this too soon. And if you're going to do it this way, here's the criteria. But at the same time, we're asking people that wouldn't get off the beaches. We're asking people that wouldn't stop partying,
Yeah.
that stop having gatherings to adhere to these soft reopenings. I mean, if they wouldn't stop going to the beach and wouldn't stop partying, who's to say that they're going to, apply these other criterias?
Mhm.
Right. So I mean, it's really the same thing. You can't control other drivers on the road, right?
Okay.
You have defensive driving because you can only control what you do. At this point in
Yes.
time, you know, whether we like it or not, or think it's smart or not, the states have decided that they're going to reopen in their own time. And they have these phases that they've rolled out, right or wrong. But the thing that we need to be aware of is, your comorbidities,
Yeah.
what you're comfortable with. Just because something's open, again, doesn't mean that you need to go. You know, there are
Absolutely.
things that you need and there's things that you don't need. You need food, you need gasoline, you need health care. Those are
Mhm.
things that you need to go to. Weigh the risk. Do you need to sit in a movie theater for 2 hours?
Mhm.
Is it that important to you? Is it
Right.
worth risking your life for? If you're 80 and you have hypertension and congestive heart failure, no, maybe you don't need to go to the movies. Um, if you're younger, it's a risk benefit analysis, basically. And this is now becoming in the hands of the individuals to determine whether or not you feel like you're safe going out. Now, on the healthcare side, when we unveil and say, is it safe for people to go out? What we're looking at it from is, are we able to take care of patients as they get sick as we reopen things? Because
Hmm.
that was what
Exactly.
flattening the curve was about. We knew that people were going to get sick. That's inevitable.
Yeah.
But can we take care of them? And at one point, we were overwhelmed and we couldn't. At this point, we can.
That's a really, really
So
good
So
that
point.
is where the healthcare system contributes to, do we think it's safe to reopen? Our position is, can we take care of you if we reopen? And when you do reopen, can you put in place measures that reduce the rate of transmission? Meaning, is your space big enough that we can keep people 6 feet apart? And we chose 6 feet because that is the average distance that a cough or respiratory droplets can travel.
Yes.
And wearing the mask will reduce that. So
Mhm.
that's why we have people wear the mask, because it reduces it from 6 feet, on the order to maybe 1 feet or 2 feet. That's why we have people wear the mask. Um, and so, from that standpoint, it is, what are your comorbidities? What do you feel
okay,
comfortable doing?
Yeah.
okay.
And
So
with that, do you feel that the healthcare system is ready for, say, they hit a surge or had a surge in the fall? Um, it seems like there's beds now. Like if it hit a certain number, a certain threshold, do you feel like the healthcare system would be ready to take care of any surges?
in the
No, I
fall.
I can only speak for the healthcare system that I am in. You know,
Yeah,
you might see something
absolutely.
different in Ohio or something, but in the healthcare system that I am in, we've now seen the cases drop off in the hospital. So yes, we're able to take care of another resurgence when and if it happens here.
Okay.
Mm. That's good. We talked about you kind of talked about I'll say essential things like whether you should be going to the movies or whether, making decisions about your life. Um, how does that apply to people who may be sick? And so they're trying to determine, should I go to the hospital?
That's a good
Will
question.
that put me at risk? How do you kind of prioritize illness? Should I be going to the hospital if I, have some other condition? Versus maybe staying at home and trying to,
Wait it out.
self-care or yeah, or wait it out. Where how do you figure that out?
Well, that's a good question, Myra. And one of the things that we've actually seen with this pandemic is that people are coming in with more severe disease because they're scared to come to the hospital.
Wow.
They come in with their diabetes at a point where they're in diabetic acidosis, or they've come in and their heart failure is so decompensated that they can't really breathe because they're staying away from the hospital. Healthcare, especially for chronic diseases, is something that you should seek out. That is not something that you stay at home and wait it out.
Yeah.
That's definitely something that needs to be taken care of, and you should go out of the house for if need be. I know that there are a lot of virtual appointments, and so reaching out to your doctor in that way. But again, the ER has in place measures to separate the COVID and non-COVID patients. So I don't want anyone to come away feeling like they should be afraid to go to the emergency department because they're going to get COVID if you have, decompensation of your pre-existing medical illness.
Hmm.
Yeah.
So, our bishop is fighting cancer. Every time he goes to the cancer treatment center, all they do before they let him come in is take his temperature. What do you think about that?
That's something that we're seeing everywhere. When I go to work, they take our temperature every time we come in. That is one way to screen, but you could easily have the virus and not have a temperature. But
Mm.
I do think that any screening measure in place to keep the your workers safe and the people in the hospital is important to do. At our hospital, before anyone comes to surgery, they get a rapid COVID test. That's what we are doing. But there has to be measures in place so that not only patients feel comfortable coming to the hospital, but workers and other patients that are there and dwelling in the
Yeah.
hospital know that they're going to be safe from this virus as well. So that we don't keep people away from the healthcare system. There's more than just COVID-19 that goes on in the community, and we need to be able to let people feel safe and confident to come to the hospital and that they'll be treated.
So
Yeah.
do you feel like it's okay to go? I mean, I know a medical professional at Northside Hospital, right? They've been working at that hospital for some 20 years. Very big, prominent hospital here in Atlanta. Their COVID patients are pretty much down to zero right now. So is it safe for people who have other issues, diabetes, heart-related illnesses, cardiovascular illnesses? It's cool for them to go to the hospital now to if they're having troubles and pains and stuff like that. You would encourage them to go.
If you are feeling again like you're in a life threatening or very severe situation, yes, go to the hospital.
Yeah.
If you have a question, again, we are encouraging people to reach out to their healthcare provider over the phone and talk to them. This is still something that we are suggesting. Now, again, if you have a life threatening illness, if you cannot breathe, things like that, you still need to go to the emergency department. And so that there's a fine line, or if you put in a call to your primary care physician, they don't get back to you in a reasonable time frame and you feel like your condition is worsening, by all means, go to the hospital. That is what we are there for.
Yeah.
Okay.
So Dr. Wilson, healthcare workers again are on the front line. You all are dealing with people with illnesses all the time. It can be a very, I imagine, high anxiety, maybe even high kind of depression type environment. How are people, the health practitioners and health workers,
Good question, Myra.
staying well? Like, what are some of the practices for
Their
like maybe
mental
some
wellness.
mental wellness, that you all are practicing to make sure you have to give to those that are sick?
Well, I can speak for where I work. Our administration has been very, very supportive throughout this time. There's been many people that have donated food
Mm.
and resources like that just to show their appreciation. They've poured a lot of resources into our mental health system. We have a meditation room at the hospital if you need to take a break.
Wow.
There's counselors via Skype and online and via phone if you need to, in terms of staying well and safe during this time. But yes, it is a very high anxiety
Mhm.
time that can really wreak havoc on your mental health over time. But I will say that at least where I work, they've done a great deal in pouring into resources into helping us be able to have access to mental health resources as we need them.
I think so, and I think you all deserve like a 3-month vacation when this is all over to Fiji or somewhere, wherever you want to go.
Or
That's
Florida is
amazing.
my choice.
Yes, a place of your choice. I think
She's
you should
Melanie's
go.
been everywhere. Bora Bora. She's been all over.
Well, pick your favorite place and, tell them that Myra said you need 3 months off and you just need to go there and put your feet up. I think
And
you all
who knows,
deserve
we
it.
might be right back where we are, Myra. Who knows?
That's
Oh
a good
God,
point. We
please
don't
don't
want
say
that.
that. Please don't
We
say
don't
that.
want
We
that.
got a question we
No.
want to get to from the audience. If you are a diabetic, is it necessary to get different vaccines such as the flu shot?
I would encourage anyone over the age of 60, and yes, with diabetes or hypertension or heart disease, to get the flu shot. Yes.
Mhm.
Okay, cool.
Yeah. Do we have some more questions?
So yeah, we're gonna get to that. Uh, I have been talking to Bishop about because eventually churches are going to open and our members are going to be eager to get back to church. And you said something that stuck with me, right? The 6 feet recommended distance is because a cough or other allergens or dust mites or whatever only travel 6 feet, right? And
Not
then
really average.
on
They can
average,
travel up to 12 feet.
they could travel up to 12 feet.
Hmm. There
I
it
did not
is.
know that.
I didn't either. I'm learning a lot, Dr. Wilson. This is good.
On average, they travel up to 6 feet, but they could travel
Yes.
as much as 12 feet.
Some of them can travel 12 feet. Yes.
So if we were to be super safe and super cautious, we would sit people 12 feet apart and make folks wear masks in church if we reopen church. You're laughing, but I'm dead serious because I know our folks want to come to
They
church.
can travel up to 12 feet. The average is 6.
Maybe they wear masks in church. Would you?
I mean, I'm all for
You wear a mask, what we see is when you wear a mask and you cough,
Yes.
there's gravity, so some of it falls to the ground. Most of it you will see travels upward, actually. Most of that cough will travel upward, and then the distance is severely decreased to maybe about a foot.
Okay.
when you wear a mask, they
When
travel.
you wear a
Okay.
mask. Yes. And so remember, so that's remembering if you're wearing a mask that is not an N95 mask, a regular surgical mask or these cloth masks that are people wearing, this is protecting the environment from you should you be an asymptomatic carrier
Yeah.
of the virus.
So the N95 mask, the cough goes up and is only 2 feet, or any mask?
No, any mask, 1 to 2 feet, you see the cough go up. An N95, I said this, so the surgical mask is to protect the environment from you.
Mm-hmm.
An N95, the difference in that is that that protects you from the environment. So that is why the healthcare workers wear N95s.
Got it.
Okay.
Because
Yeah.
only 90, it filters 95% of particulates from getting through the
In
mask
mask.
into your respiratory system.
How can we end on a high note, Dr. Wilson? Like, what are some?
We can talk about going on vacation
Well, we
together.
talk about going on vacation, but I want to.
That's
I
a
want
high
to end
note.
with hope. Like, I think that's important.
You're
I
right.
think
You're
have been
right,
in their
Myra.
homes.
I told
What
you
are
she was
some-
better than me. Look at her.
No, I mean,
This
as,
is Myra
as
in
we
action.
talk about, this is
Let's go,
necessary
Myra.
conversation.
You're right. You're right. I'm with you.
But what are
Right,
some of the?
I know exactly. Every time I come on, I feel like I'm delivering something.
You're delivering important
Maybe
information.
people feel so good.
It's
That's all right.
necessary, important information.
But you're doing it and you're smiling and you're
Yes.
healthy, and
Yes.
we love
We
your
love it.
energy.
This is
So thank you for
necessary
that.
and
We would
important.
love to, if you deliver bad news to me every day, it would just be amazing. So thank you
As
for
long as you
that.
have on your smile and your nice power shirt, your power red shirt, like Myra's.
But
It's actually blood orange, Taylor, but thank you.
there you go.
My wife tells me I'm colorblind, so there it is.
If you were to offer hope, if you were to, even tell us what you're hopeful about as we approach the days and months ahead, what are some things that you're hopeful about, you're looking forward to? Offer us some good news, and maybe some even parting words, some parting thoughts, just about this whole ordeal.
I mean, I would say that I am encouraged that everybody has really come together and stayed at home, either reluctantly or willingly, to ease the burden on everyone and the healthcare system. So that is something that's positive.
Mhm.
Um, I know that we kind of, as Americans, think about it as we're in this alone, but this is a global situation, and we are actively getting information and benefiting from studies that are going on overseas who are kind of ahead of us in this disease process.
Yeah.
I did learn today
Yeah.
that Oxford University is now rolling out a trial for a vaccination that they feel like is very promising, and they're hoping that that'll come to fruition in September.
Wonderful.
That's good.
So that's something that's promising and optimistic. I know that we've heard about the drug remdesivir, which has also been a promising drug in the treatment of this. So, I mean, we are getting there. We're learning more. We're making headway on what it is that we need to do to stay healthy, what it is we need to do to prevent the spread of the virus, and eventually making headway to a vaccination. So, I think now the difference will be, you know, on the other side 7 weeks later than we saw 7 weeks ago, is that we will stay away from each other. Many of us have lost people or knew somebody that had the virus. So I think there is more care and compassion and patience that we have, that I personally am seeing in the community. So I find that to be very hopeful. I know 7 weeks ago, even myself, I found myself saying, well, coronavirus is responsible for the common cold. How dangerous can this be?
Yeah.
I know better, as I feel like having these kind of discussions just with us and in other forums will provide. So I think that, to me, what makes me hopeful is that as we continue to educate people and people are more receptive to hearing about it, that they will take the appropriate precautions to not only help themselves, but help other people in the community. In addition, the last thing I will say is I took this time to find, I met my neighbors for the first time.
That's true. You're
We all had to stay
talking
at
real
home.
talk.
They were really nice. I mean, you just see people
Yeah.
really reaching out and
True.
helping people and doing nice things for one another
Yes.
and really caring for each other. And that is
So true.
just, so heartwarming and so beautiful to me. And
Yes.
I think that, you know, not that I think that we should have had a pandemic, but if there's any light in this, it's that you can really see the compassion that people have for one another.
Absolutely agree. Human beings are being human again.
Yes,
It's a beautiful
I
thing.
totally
It's a
agree with
beautiful
that.
thing. Yeah.
Oh, well, wonderful parting words. Anything else you want to add from your Dr. Fauci, or you're good?
Well, I love Dr. Fauci, so I will say that I know that there are a number of different outlets that people will still get information from, but obviously this is an ever-changing situation.
Yep.
And for the most up-to-date information, go to cdc.gov,
Yes.
and that will have the most up-to-date information in terms of how to protect yourself, how to protect others, what are the recommendations, what are the guidelines, what symptoms, should you go to the hospital for, when should you call your doctor.
Okay.
Appreciate that.
Okay.
Good. My Spelman sister, I forgot to mention that in the introduction.
Exactly.
Yes, Dr. Melanie Wilson, brilliant. Thank you so much for your insight and all of the wisdom that you shared, Taylor.
So yeah, thank you, sister. Not my Spelman sister, but my sister's sister.
She's jealous.
I am jealous. There's nothing like the camaraderie
You
of.
did tell us you were a Spelman woman at heart.
I think that's the word to use. Yeah.
I said that I am an honorary brother of the Spelman sisterhood community.
We'll take it. We'll
You
take
guys
it.
have a camaraderie that is second to nothing, and I always hear young ladies say when they leave that campus, they never have that experience again. So
Like
whatever you
none
guys
other.
do, it's really special.
I appreciate that.
It's really special, and I am
Thank
so
you.
glad that
Thank you.
I was good enough to be able to marry one. And make,
Exactly. My
make the
college
cut.
roommate, you married her. And
I
next time
married
come
your.
on, I'll have a college T-shirt.
I married your college roommate, and I was fortunate enough to not let her get away.
Janelle. That's a shout out to Janelle.
Of course, a shout out to Janelle. I try to shout her out as much as possible.
Oh,
We'll
that's
just
so beautiful.
did you hear?
Again, see, beauty in COVID. You
Yes.
guys quarantined together and you got through it.
Yes, yes, it is
It
getting
made your marriage stronger.
getting
Yes.
better every day.
There it
We've
is.
been walking every day, and we really like it. I'm not going to tell you how many days. I'm just going to stop talking about this before something else happens.
Yeah.
All right, and you heard that, right?
Yes. Yes.
In any event, so membership, friends, extended family, let us know about what you would like to see. We will work very hard to bring it to you. What topics you would like to see. Obviously, you see that we have a lot of reach here. Dr. Wilson, Dr. Moore, Dr. Ash. Again, we thank all of you for watching. And again, we do this so that you are informed. And if you are informed, you can live powerfully. And if you live powerfully, you live your best life, you're your best self, and you do your best by others. So again, please let us know what topics you would like us to touch on. I am very interested in still trying to do our cooking show. We want to do some stuff because everybody, I was supposed to be learning how to be a better cook, but
We'll get there.
COVID has made Myra and myself and my partner David and my wife, all of us very, very busy, more busy than we were without COVID. But again, we want to thank Dr. Wilson for being with us. We want to hear from you and see what other topics that you want to have. We're going to try to bring on an Atlanta police officer next week. We feel like that will be very informative, considering the circumstance and the climate of things. And again, we're going to work on our cooking show, but please let us know what you want to see. Myra and I will be back with you next week.
Yep.
Thank you, Myra. Thank you, Dr. Wilson.
Thank you so much.
Thank
Dr.
you,
Wilson.
David. Thank you, Janelle. Thank you to all of our audience. And we appreciate you. And we will see you Sunday. And we will see you again on Tuesday.
Next week.
All right. God bless. Bye-bye.
Bye.